bugger answers the phone.
Linda Magis wants her 39-year-old disabled son, Ryan Attard, vaccinated.
I haven't hugged him since March 15th of last year.
They FaceTime 2 or 3 times a day.
Miss you, mommy. No.
I miss you too, baby.
Coming?
Yep, pretty soon. Yep.
I love you, mommy. Bye.
Bye, honey. I love you. Mwah.
Attard lives in an apartment for disabled adults run by the Salvation Army. He last saw his mother in October before strict visitor restrictions were put in place. Currently, residents are only allowed to leave for personal banking or to take a short walk around the building. There are 21 residents.
Contracting COVID for any of them could be just as serious as a senior citizen contracting COVID. So I believe that they should be in the first phase, and they should be done now. Not in a month, not in a week, but now.
Most residents require 12 or 24-hour care. There's 80 staff members, roughly 10 have been vaccinated.
Please, look at the science and think about this priority population.
Krista Kaur is the Executive Vice President for Inclusion Canada, who advocate for people with intellectual disabilities.
6 out of 10 people who died of COVID had a disability.
She's referring to a study out of the United Kingdom.
Unfortunately, because we aren't collecting the data in Canada the way other countries are, we don't have a lot of Canada-specific data.
The New England Journal of Medicine found that people with intellectual disabilities present the strongest risk factor of dying from COVID-19 other than age, while the World Health Organization says that people with disabilities may be at greater risk of contracting the virus.
And in Ontario, we have recently heard that people with an intellectual or developmental disability are going to be in the phase 2 prioritization, and that's good news. And the territories have also done that. But in most places in the country, they're not in the priority.
And the rollout is crazy.
Asniv Mallet is the Hamilton chair of the Advisory Committee for Persons with Disabilities. She's not old enough to get the vaccine yet.
That's a secret.
But every day she has PSWs and nurses in her home.
They also travel around within the community to other people, and there's a high risk and potential of getting COVID-19 through them.
She says there's confusion about how disabled persons will get registered for vaccination.
First, we were told the LHIN was going to register us. Then we were told our family doctor is going to register us. And then we were told that any person who has a chronic issue and is being supported some miraculously way, they will be registered. None of this is tangible. It's not making sense.
Mallet says the City of Hamilton has committed to getting the answers needed and is cooperating. Now, persons with a disability and those advocating for them say that this is just the latest example of that group being overlooked. They feel like an afterthought. According to Statistics Canada, people with a disability make up 22% of the population. Back to you.